to it, Natalia. Thank you.
Yeah, thank you. Helen, over to you.
Yeah, that's fine. So I just want to say thank you all for joining us today, and thanks to Aisha for setting it all up for us. We normally do this self-care training every 2 months, so bi-monthly with the nutrition and hydration. So you can always link into it as and when you can. We originally did the self-care toolkit back at the beginning of 2019 to support the care homes and the GP surgeries. But that was just for Brighton and Hove, and more recently it's been updated to be Sussex wide with some new additions. So that's what we're going to be presenting to you today. I'll get some of the sort of details out the way, that a disclaimer of all the images that's used in there in the presentation are obviously the property of the respective copyright owners, and I use examples for trainers. Just for the training purposes only. So that gets that all out of the way, so that if you see any images, then that's just used for the presentation itself. The toolkit itself is supported by local CQC or adult services team. They're aware and supportive of the toolkit, and during the development of the most up-to-date toolkit, we've got CQC guidance, over-the-counter medicines and homely remedies, and also vitamin D supplements supporting people who receive adult social care. These have been considered and incorporated into the toolkit, so you see that as we go along. You're okay to pop the next slide on, Natalia?
Sorry, I can see Nikki has a question.
Sorry, I'm just asking because I've just clicked on that link in the chat, and it says about do I register as an external role?
Yes. So
Okay.
you just will need to register, and then you can access everything in the website that is available to the public. Yeah.
Okay, thank you.
That's okay.
So we've got some of the learning outcomes. So by the end of today's session, hopefully you'll be aware of the NHS England guidance on self-care and exceptions. Know the difference between a homely remedy, self-care and personal care. And
the porridge, what it is, what that might mean, and also he's going to deteriorate.
And so, thank you. And this can sometimes be the area that's a bit sort of grey and where everything overlaps, so that hopefully that will give you a bit more sort of clarity. Understand what a homely remedy is and their locally approved list of homely remedies and when it's appropriate to use. Understand the key points of self-care treatment and understanding the conditions appropriate for personal care. So why do we need to change? As I say, this was obviously set up originally back in 2019, but even prior to that, we have some information as to sort of the spend with regards to the NHS. So in the year prior to June 2017, the NHS spent approximately 569 million on prescriptions for medicines which could be purchased over the counter. We've got more local data from March 21 to February 22, which shows the areas of Sussex. And we obviously had a spend of nearly 15 million overall. And that's been broken down into Brighton and Hove, East Sussex and West Sussex. It's quite evident, as you can see there, that because we'd actually already started with the Brighton and Hove self-care toolkit, that's made quite a difference in the spend in that area. So we're hoping now that it's Sussex wide that we can actually then link in with East and West Sussex and support that there as well. This is just a slide which will help to bring it into perspective of the spend. Sometimes it can be quite a concern for the care homes, especially in this current climate with the cost of living, with regards to the spend that they might need to put out there for each resident. This was a pilot that was in St Leonard's, and they actually looked at I'm just having a look at 312 residents in total over 11 homes in between January and March 2019, and there was an average cost per resident of 75 per person over 12 weeks, or 25 pence per person per month. And obviously that in itself reduces unnecessary workloads for healthcare professionals, frees up the capacity, and helps with the sustainability of the NHS. So originally the toolkit was developed to aid care homes and GP services to meet the NHS England guidance, which is there in March 2018. It was advising on conditions for which over-the-counter items should not be routinely prescribed in primary care. It focuses on conditions that are self-limiting, not requiring medical advice once the toolkit's in place and the GPs are aware, and suitable for treatment with over-the-counter medicines. It also covers vitamins and minerals and probiotics, and further details can be found on the link that's here for you, and we can share the slides with you at the end. As always, with everything, there is always exceptions to the guidance. Patients that are being treated for long-term conditions obviously can continue to be prescribed medication rather than buying it over the counter. There are certain circumstances where the product licence doesn't allow the medicine to be bought over the counter because of age or the use. So that's,
did you say
so that's important. Individual patients where the clinician considers their ability to self-manage is compromised, and that can be down to medical or mental health, significant social vulnerability, or obviously, you know, if they can't afford to be able to purchase over the counter. So that's to the extent that their health and or well-being could be adversely affected if they're reliant on self-care, and that will be down to the individual GP for an individual circumstance. The self-care toolkit itself is split into 3 areas. So we've got self-care, homely remedies, and personal care. Natalia is now going to speak a little bit more length into each of the individual areas.
Thank you, Helen. So, to support the NHS self-care campaign, Sussex NHS Commissioners, in association with Sussex Community Foundation Trust, developed a self-care toolkit as a guide for care homes to support residents in self-caring for selected conditions by buying over-the-counter treatments, as well as the use of the traditional homely remedy scheme. Additionally, some items that historically may have been prescribed can be considered as personal care items, which can be bought over the counter by the resident or care home staff rather than being prescribed. As Helen said, the toolkit has 3 sections: self-care, homely remedies, and personal care, and I will be talking about them in a little bit more detail. So the first section is self-care. So self-care products are medicinal preparations used to treat minor ailments, which can be bought over the counter and do not require a prescription. These medicines will be specific to the resident and may be used for short term, such as earwax remover, or for long term, such as eye lubricant. Self-care treatments includes items bought over the counter by residents or relatives approved by a healthcare professional. So, for example, we have Mrs. John's daughter that got these great vitamins for her mother. So she will go to the care home and ask the staff, you know, could you please administer these vitamins to my mother? And that's something that care home staff will check with the GP if it's appropriate for Mrs. Jones to have the vitamins. Other treatments include items bought on behalf of the resident as recommended by a GP or other healthcare professional to treat a minor ailment. In this situation, the healthcare professional should indicate how long the treatment is for and state the dose if differs from the product package information. If the symptoms of the patient worsen, GP, other healthcare professional, or community pharmacy should be informed earlier than the initial recommended duration of the treatment. These medicines are specific to the residents and should be added to the MAR chart unless patients self-administer. Patient's name should be written on it, and instructions on how to take them should be recorded on the resident's care plan. NHS England has provided a list of common minor ailments that may be treated as self-care at the recommendation of a GP or healthcare professional. So here we have, obviously it's not the whole list because it's a lot longer than that, but we have a few items that can be considered as self-care. Like, for example, someone who has conjunctivitis, so, maybe eye drops or ointment, antibacterial would be recommended, or, dry eyes, oral thrush, travel sickness, vitamins, as well as saying, any of these minor common ailments can be recommended and bought over the counter for the residents. Do we have any questions so far about this self-care? No? Just please stop me if any questions come up or anything like that. So the second section of the toolkit is homely remedies. So homely remedy is another name for non-prescription medicines, which are kept and used in a care home for the short-term management of minor self-limiting conditions. Minor conditions include cold symptoms, headaches, occasional pain, or indigestion. Homely remedies should usually only be given for up to 48 hours. After 48 hours, if symptoms persist, staff should seek advice from GP. This is the list of medicines agreed by Brighton and Hove ICB, I should say now, suitable for stocking at the care home as a homely remedy. In the toolkit, there is some further information about these items or medicines, as well as flow charts to support care home staff if a homely remedy needs to be administered. In the toolkit, there is a homely remedy template, which can be adapted to any care home, as well as marked charts for homely remedies, stock control sheets, and a staff list where all care home staff using homely remedies should be named in it. The advantages of using these homely remedy templates is that replaces the need to sign individual agreements for each resident for this approved list of medicines. Once the GP is aware that you are implementing this homely remedy policy, the approval in each occasion the patient is having the medicine is not required. Okay, that does make sense. I'm not sure if anyone will have any questions about this so far. Okay, I carry on until you stop me. Okay. So here we can see one of the medicines information included in the homely remedy templates. This one is around pain. So obviously we have the paracetamol. As you can see, it looks pretty similar to the PRN protocol in care homes. So it's name of the drug, indication for use, what's the strength, what dose should be administered, what the maximum dose in 24 hours, maximum duration of treatment as homely remedy, any cautions you need to have, any additional information, and any additional resources. And then following on this, we have a flow chart that is to support care home staff to administer paracetamol when required. So as we can see, it says it's mild pain only. So all cases of sudden onset severe pain must be referred, and there is to support the care home staff to administer the paracetamol. So has the service user been given any medicines containing paracetamol during the last 24 hours? It's just kind of a reminder for them what things to look into before administering the paracetamol to the resident. This is another medicine information that we added. There is one for each of the items approved by the ICB. This is for diarrhea, so diarrhea sachets, again, indication for use, strength, dose, maximum dose in 24 hours, any cautions, additional information, or additional resources. And here we have the flow chart as well. So diarrhea in frail elderly can quickly lead to dehydration and deterioration in health. So you can see what things staff should look at, before administering, or, in which moment, it would be appropriate to contact GP or NHS 111 if, your patient is feeling unwell. Example of, from the homely remedy template or policy included in the toolkit. There is a mark chart for each of the items, and that, as I said, it can be adapted anytime. Are there any questions so far? Good. Okay, so
I'm just trying to find. Sorry, I've just found the home remedy. So
yeah.
Basically, so every time, whatever, there's lots of things, different things on the MAR chart. So if you like, so for instance, you give a paracetamol, and say a week later you give something else. Do you fill it in on the same chart, or do you do a separate chart for every single situation?
Well,
It's got week
I
1
would,
to week 2, week 3, week 4 in it.
yeah. So you have there 4 weeks, so that mark chart is for a month.
That chart looks different to what we've got on the home remedies policy that we've got through. That chart looks different.
Yeah, I'm guessing, probably, different policies has slightly different mark chart, I would say.
Okay.
But, here is for a month. If your patient had some paracetamol on week 1 and then week 3, maybe when you move on to the next cycle, you should add a new mark chart if it's required. You don't need to have all the time homely remedies every month in each of the residents.
Okay, yeah, and I can see some of the and some of them are charts. So like if you give paracetamol and you live Laxido and it was within 1 month, you could put that on both the sheets, yeah?
Yeah, in the same one. Yeah, you could do that. Yeah.
Okay.
Yeah.
And we have Ashton, so we would update this and put it into the patient's record. So I'm just wondering, could we update it onto, would we just completely leave the other system alone and not put it on Ashton's and just put it on these home remedy charts? So that we've got,
you have electronic mark charts, isn't it?
Yeah.
Okay, I don't remember very well. Do you have a section where you can add any homely remedies? I know you have PRN and then regular meds, but I don't remember now. You have another, in the Aston system, you have another place where you can add homely remedies.
I think we'll probably just have to have a good look at it, Growth Park guys, and just have a little look. We need to make sure it's all in one place, don't we?
Yeah, well, that would be ideal. So you have, everything on the same place and you don't have to be looking into different places. But, Nikki, I'm happy to pop in. In fact, I need to go and see you at some point. So if I'm there and you need any support, just let me know,
Okay,
so,
thank you.
Yeah. I hope that answered your question a little bit.
Thank you. Yes, it did.
Okay, so the last section of the toolkit is personal care. So personal care are products outside of the scope of medical care, available over the counter, in supermarkets or petrol stations. Advice by a healthcare professional is not necessary. Does not always need to be added to the mark chart, but it will need to be recorded in the patient's care plan or daily personal care log. However, it is recommended that regular items are added to the mark chart, so that way you ensure of regular dosing and also any stock management you may need to have. In the toolkit, you can find a list of common minor ailments provided by NHS England that may be treated as personal care. So in the next slide, as you can see, we have a few minor common ailments, such as acute sore throat, that you can go to the shop, to the pharmacy or even petrol station and get some lozenges, or dandruff, so get some anti-dandruff shampoo. Mild dry skin, this is where the emollients come along, emollients and creams that are considered as a personal care item, and so on. I think, NHS England, if you follow the link, you will have a more complete list of minor common elements. Any questions so far about personal care? No? Okay. And now here is a summary about the 3 different sections in the toolkit. So as you can see, we have self-care, self-care, that items bought over the counter for a specific resident with healthcare professional approval, needs to be added to the Marshall and care plan. And we have some examples there, such as cold sore or dry eyes. Homely remedies are approved items stocked at care home to support residents in self-limiting conditions, which can be administered for up to 48 hours. No healthcare professional approval is required at each occasion, as I mentioned before, but it will need to be added to the marchers and on the care plan. And we have some examples there, such as the pain or indigestion or diarrhea. And personal care are items outside of the scope of medical care, easily available over the counter, don't need healthcare professional approval, that's not required to be added to the mark chart, but it will need to be recorded in the care plan and in the personal daily care log. Does that make sense with everyone? Any questions so far? All good? Brilliant. Well, now I'm going to pass over to Helen, who's going to talk about our dear vitamin D. Oh, sorry, I had that this last slide. This is again an example. So we have a homely remedy Marshall example as we had before, and this could be for self-care or personal care. This is exactly the same, but you just fill in, the different boxes depending on what your resident is taking or is being advised to take. And now, yes, now we go to vitamin D, Helen.
That's lovely. Thanks, Natalia. Do you mind just popping back to the summary slides? If that's okay. I just wanted to say to people that a lot of the homes have actually found these quite useful to print out and put into their medication trolleys, or where they actually sort of put their in their medication rooms and treatment rooms, just so that it's a quick sort of visual for people to see as and when they're doing medications. So yeah, I just wanted to pop that in there. Yes, Nikki, you got a question?
Yeah, so I was just going to say what would be really helpful, and I know that it's very basic, but even like the pictures of what is personal care, what is home remedies, because I don't know, people might get confused. Is there any pictures or anything that we could give? What like you've got those pictures on the Vaseline that says that was personal care. Somebody else might not know that. So is there any way we can have the pictures?
Yeah, I mean, it is one of those areas where people do get really confused, even us sometimes.
Yeah.
And we've been sort of using it for quite some time, so I can appreciate that. The difficulty sometimes with the pictures is obviously that the copyright is there because of the products, so but equally it's there for the training purposes. So I mean, if any of the slides help and you want to print those out, then that's absolutely fine. But yeah, it can be quite difficult to actually sort of separate it into what's self-care and what's personal care. So if we can support you any further with anything, then I'd happily sort of take that and we can see what else we can do for you.
Okay, thank you.
I just wanted to add something, sorry. You can also, when you go to the NHS England website, where it talks about the self-care campaign, you will probably have there quite a lot of information as well. I'm not sure if you are going to get exactly pictures of, each of the items, but, maybe you have some more information there you can refer to. Or as Helen said, you have some list there. You can also print it, for the staff, if that you feel that would be useful. Sorry, Helen.
No, that's no problem. Thank you. So the vitamin D section is a new addition to the self-care home self-care toolkit for care homes. and that's come around because of the care homes are now expected to support service users' nutritional requirements, and vitamin D falls into that. Includes the supplementation of vitamin D through the winter months or throughout the whole of the year, as recommended by Public Health England. And obviously there was a campaign where vitamin D supplements were actually supplied to care homes during the pandemic, which now is obviously discontinued, but they want you then to continue with that supply. So provision of vitamin D supplements should be person-centred. So obviously depending on whether your residents are sort of suitable for vitamin D supplementation, and care home providers should incorporate vitamin D provision into the existing routines and care plans, which are designed to meet the nutritional and hydration needs of the individual residents. As always, as I mentioned earlier, there's always exclusions, and for the exclusions for over-the-counter vitamin D, if residents are already taking a vitamin D supplement or medication containing vitamin D, such as a calcium and vitamin D supplement, then obviously they don't need the additional vitamin D. Those residents that have a medical condition or treatment that means it may not be safe to take a vitamin D supplementation, and that can be an example of high vitamin D levels, current or previous kidney stones, raised parathyroid hormone, and obviously these would then mean that clinically the vitamin D would not be suitable for that resident. This is an example of the consent template for each resident, and the idea behind these is that you have this for each individual resident and in their care plan. Fill in the details of the vitamin D strength and form that they're taking, and it's got a care home checklist in there just to cover yourselves with regards to sort of what's important for the vitamin D supplementation and whether it can be prescribed or given sort of through the self-care. Are there any questions around the vitamin D part? Because it is quite a new sort of area, and obviously it's on the back of the fact that a lot of the homes have also already had supplementation sort of provided for them, so at the moment it can be difficult to sort of tell whether some are already being prescribed where there might not necessarily be clinically a need for that, and that should be moving to self-care, but it is a bit of a sort of an early days section of that. Sorry, Nikki, you've got your hand up there. Have you got a new question? Oh, you're just on mute, Nikki.
Sorry, let's take that off.
That's
I
okay.
can't see the vitamin D consent template in the actual Home Remedies guidance that we've got. Can't see that template in there. The Self Toolkit.
Maybe I will send you. I'm not sure when did I send it to you, but it's been recently updated.
This
So
one.
maybe.
Yeah.
It
So
might
it's
just be
July.
that it's the new one.
Yeah. It's July 2019. The copy that I've got.
Okay, I'm gonna put the latest version now in the chat so everyone can access it, just in case that it's an old one. Sorry, yeah.
Okay, thank you.
I don't know, Helen, in the meantime, you want to carry on with the case studies while I'm finding?
Yeah, that's fine. Do you want me to move the slides on? I'll apologise in advance, by the way. My camera's plunged me into some sort of darkness, so apologies if I'm in the shadows. So we've got a couple of case studies just to bring that into context. So case study 1, we've got Mr. Smith that's been complaining of waxy ears for a couple of days. His GP has seen him and told him that he needs some olive oil ear drops to loosen the wax. So just a question as to how you would obtain the ear drops. Which section would you think that this would fall into? So that's right, Luke. Yes, self-care is the correct answer. Yeah, so it falls under self-care. So the medicines would be bought for the specific resident and available over the counter. The approval is from the healthcare professional because obviously the GP is advised. That's what the GP is advised, and that obviously can be the nurse or the pharmacist as well. It's recorded on the MAR chart and it's also recorded in the care plan as well. Then we've got case study 2. We've got Mr. Jones. He's 75 years old, lives in Beach Retirement Home. His daughter's noticed that he suffered from some sunburn, if only after all this rain, after sitting out in the garden, and bought in a tube of aloe vera gel for him. And his daughter asked if he can help him put the gel on, and has also requested some paracetamol to help with the pain. So on his MAR chart, he's got prescribed medicines of amlodipine, 1 daily, and omeprazole, 1 daily, and he's allergic to aspirin. So what would you do in this situation? How would you deal with the paracetamol and the aloe vera?
I'm going to let the team answer. It's important that they answer those questions.
No pressure.
We need the clock like countdown.
Did
Luke's going.
Oh, he's on it. He was good last time.
Let's see who's got it.
So if you just move on to the next slide, Natalia, we'll have a look.
So
I like that you put a question mark there, Luke, just to cover yourself. So the aloe vera gel would be considered as personal care. It doesn't need any approval from the HCP, but you can seek advice from the pharmacist if needed. So that may be if you're concerned if it's going to sort of interact with anything or if you've got any concerns. The MAR chart entry is not required, but some places do actually pop it onto the MAR chart just so that it's there and visible, and that you can document it on the residence care plan. So it's there visible for everybody who's looking through. The paracetamol would indeed be on Homely Remedies, so you get a point there, Luke, for popping that on. And you can record the administration on Homely Remedy MAR chart, record it on the stock control form, and it can be administered for up to 48 hours. If it's needed for any longer than that, then obviously you would then refer to the GP for advice and continuing treatment. The one thing I will say with regards to that, we do sometimes get asked with regards to the 48 hours, because as always with these things tend to happen late on a Friday, and then you've got the weekend and not being able to get hold of anybody, and that takes it over the 48 hours. So most GPs, and obviously it is in line with speaking to your GP, but most GPs will be happy for that 48 hours to incorporate that amount of time before needing to then speak to them on the Monday, rather than using the out of hours services. But equally, if you've got any major concerns in the meantime, then use the out of hours 111. And I think that brings us to the end, and any sort of questions that people might have.
Amazing. What do you want to eat tomorrow? Wait, but are we?
Okay, I'm not sure if that has been okay with everyone. I don't know if you have any questions. This presentation is more, directed to care home staff. So yeah, so I'm not sure if any questions come up, any thoughts, anything at all.
I think it's like anything, once you start getting used to it, and you start doing it, and you get used to using it that way, don't you? I think for me, the main thing I've kind of learned is that actually, if there's something that needs to be more regular, then that needs to go on to, so you're back to using it on Ashton's. But if it's just the ad hoc thing that now and again, that's when you kick this in with the home remedies.
Yeah. And can I ask you, Nikki, has Ashton's provided you with a homely remedy policy?
No.
No. Okay.
No.
Okay.
Yeah.
Okay. Yeah.
One thing that I would suggest, sort of from a PCM perspective, the care home PCM perspective, is that when somebody has been using the homely remedies, as shown here, and they've been using it at the full dose for that full amount of time, you would then contact us for that resident to be reviewed.
Yeah.
You would need to know why they're still needing it, if they still need
Exactly.
it, and if so, then then we can prescribe it if needed. So that would then something that would then come into us by email, and we would then be able to action that.
Yeah.
Yeah, and I think alongside that as well, Aisha, it's important to note that obviously you could have a 48-hour period and then that not sort of breach that, and then a few days later you could have another 48-hour period. So those are all
Yes.
fine as individual things, but then if you've got a concern going forward that that's happening quite regularly, then that would be the time to then raise it with yourself, even though the 48 hours hasn't been breached for each of those occurrences. There's obviously
Sure.
something maybe more going on there.
Yeah. Does everyone understand what is said there in regards to that sort of repeated episodes of 48 hours?
Yeah. Luke, Peter. Typing.
And I think also as well, what's oh no, can you go over it again? Okay, so do you want to do that? That might be more clear coming from you, Helen.
Yeah, no, that's absolutely fine. So each time that you're using the homely remedies, say the paracetamol or the Gaviscon or whatever it is that you need, if you're then getting to that 48-hour sort of cut off, as it were, if it goes over that and the resident is still needing that medication, then that's the time that you would get in touch with the PCN team to review what's going on, why they need it, do they continue to need it. But if they only need it once or twice within those 48 hours, but then a few days later they might need it again because of indigestion or a headache or whatever, that's okay to then use that again from the homely remedies for another 48 hours or up to another 48 hours. But if you get quite a few occurrences of those 48 hours within a month, then it's, or a month to 6 weeks, then it's probably worth still raising it with the PCN team to see if there's more going on, and they can get more support. So yeah, hopefully that's a little bit more clearer.
Thank you.
I'm not sure, Helen, you could please try, I haven't been able to, to attach the self-care toolkit to the chat. I don't know why I can't do it.
Oh, let's see if I can do it.
So I'm not sure you be able to do it, but it's not allowing me to attach anything. I don't know why.
Oh, it might be because we're not the primary, we weren't the ones who organised it. I think that might be why.
Yeah, maybe. I'm not sure, but I
Let me
tried
see.
and I can't do it, Nikki. So I will send it to you in an email. Or I send it. I'm not sure you wrote your email addresses.
Yeah,
Or,
so
you know,
we've all got NHS email addresses now, so I'm just in the
Okay.
process of moving all the nurses over to that. So it's
Okay.
Nick. I've put it in the chat. So it's Nikki
Yes, please.
NIKKI. I've already put it in the chat up above. If you look up,
Okay,
yeah,
Nikki.
.field@nhs.net.
Yeah, and obviously Namin has put that she'd like a copy. We knew that because we'd obviously popped into
Yeah,
there. So we
yeah,
can
we
send that
send
through
it
to you, Namin.
Thanks
to
so much.
everyone.
With the when we click on it, you need to put in so you need to log in. So do we just use our NHS emails? Would that work?
You can do, yeah. Yeah.
You'll need to register if you haven't registered already, I think.
Yes. Yes,
Yeah,
you need to
because
register, and you know your NHS email address is fine to register with. Yeah.
if you have any problems, Namin, just let us know.
I will do. Thank you so much.
Yeah.
Appreciate it.
Mm.
It's all so new.
Yeah.
That's perfect.
Okay.
But
Not sure
thank
if
you.
anyone.
It's new, isn't it? It's getting confident, I think, with it to take that step to do it yourself and just to have the confidence to go, okay, we'll go buy home remedies. You know, it's just that
Yeah,
step.
and it is a big step because you almost feel like you've not got that support with you. But
Yeah.
if the support is there, it's just taking that first leap, isn't it? And then, you know, if you've got any queries as you go along the way, just give us a shout.
Thank you. That's perfect. Thank you so much.
Thank you. You know, and also I was thinking, Nermaine, you know, you also, you know, in this homely remedy policy template, you have the medicines information, the flow charts that you just, you know, you can follow, you know, to support you with that administration, you know, so you ensure, you know, like you are following, you know, the path to, you know,
Guidance,
the
that's
guidance. So any questions, you know, we are here, and you know, the whole PCN team is there as well. So anytime you can contact us.
Thank you so much. We, you know, just knowing that you're there is great.
Yeah, brilliant. Good. Okay.
Okay, so if not anyone's got any more questions, then thank you very much for the presentation, Helen and Natalia. That's really useful. Obviously, the links are in your chat if you haven't got access to them. I believe you've already put your emails in for the policies to be emailed through over to you. If you could just send that to the PCN email as well. I'm sure we've got your updated one and we did send it out, but if the one that Nikki's got is 2019, then that's probably the one that we've got, because I know we sent it out again.
Yeah. I will send it to you, Aisha. Is that okay?
Yeah, that's great. Yeah, thank you.
Yeah, I think you should have it, but maybe Nikki, when I went for the first time, maybe it was the old version. Yeah,
Okay.
I will send it to you, Aisha. Yeah.
Okay.
No
All right.
problem.
Cool.
Thank you all for coming. Anyway, thank you.
Thank you so much for your time. Thank you.
Thanks everyone.
You.
Thank
Nice to
you.
see you all.
Bye-bye.
Thank you.
Bye everyone. Ciao, ciao.